Hi, everyone. So, we're getting a question that I felt like I needed to answer for this newsletter, which is it the right time to buy? And this is not as easy of a question as normal because we're in a kind of a crazy environment right now. The Fed is increasing interest rates. The stock market seems to be crashing. We might be headed towards a recession. And so the question really is, do I buy an office now? Do I wait? What do I do? And so I wanted to run through sort of a couple things with you that I think is really important for you to keep in mind. First, we got to look at history. Okay, so in history, at least in the past 20 years that I've been practicing and working with dentists and doctors, what we have seen is dentistry is very resilient, right? It's gone and survived many recessions, right? Whether it was the dot-com crash or the housing crash or the financial crisis. I mean, it survived all those and done well. It survived the pandemic for the most part. Most offices and most locations are doing better today than they were pre-pandemic. And those that aren't or weren't, have gotten to pretty much the same place. So from a recession and pandemic perspective, dentistry has done really, really well. So I think it's important to kind of keep that in mind. Now, we are in a slightly sort of different situation because in the past 20, 30 years, we haven't been in a high inflationary kind of scenario. And what's happening right now is that the federal government, because it's pumped so much money into into the economy as a result of COVID, is trying to pull back and prevent us as Americans from spending as much money as we are, right? Whether it's on TVs or cars or homes or whatever, they're purposefully increasing the interest rate so that we as Americans spend less. And if you spend less, then what happens? Well, if you spend less, inventories rise and prices come down, hence inflation comes down, right? Like, it's overly simplified, but I think you understand what I'm trying to say. So how does this impact what you're doing, as a young doctor who's maybe associating for someone? Well, what it means is that, instead of, maybe banking on super cosmetic dentistry to fund your practice, it's going to be more Crown and Bridge, the sort of the brick and mortar type of dentistry. Well, that is regardless of the economy, a better thing for us to rely on anyways, because the Crown and Bridge kind of work, the normal day-to-day stuff, the hygiene is really what is typically the most profitable, is typically what kind of keeps the lights on and keeps the businesses going. So my recommendation would be that, if you are interested, if you are associating and you have wanted to buy an office, to go ahead and keep looking for an office. Don't sit back and say, well, the economy's crashing, so I'm not going to buy and this and that. That's not the case. Dentistry is very, very protected, from that. Does it mean that everyone's going to do well? No, of course not. But you most likely will if you follow a couple of things, which I'm going to talk about in a second. But before I do that, I want to mention a couple of things. People are talking about higher interest rates. Yes, interest rates are going up, but the housing market and what you're hearing with mortgages is very different than what the dental banks are doing with regard to loans. We're still seeing loans in the 4%, whereas, if you do an SBA loan, it's probably in the 7%, or if you do a mortgage, it's probably in the 6-7% too. So just kind of keep that in mind. The dental loans are still a little bit more protected for a variety of, technical reasons, but so that part of it is good. The second part of it is that, it's never too early to start investing in yourself. And especially with most of you having high student loans, you're working, as an associate somewhere, you don't get a lot of tax benefits as a result of that. And because you're a dentist, you get to have those benefits. Most people in the real world do not get to have these benefits, and so you get to. So the sooner you start with your own practice, setting up your own corporation, buying something, the more tax benefits you'll have, the more revenue hopefully you'll have, and so the sooner you can start saving and putting money away and whatnot. Okay, so those are two of the reasons why you shouldn't necessarily sit on on the sidelines. Now, when you do find an office to buy, you got to do your homework. right? You got to do your homework. You don't just buy the first office you see. You got to do your homework to make sure it's the right practice. And doing that through due diligence is really the key. Now, I've got a ton of articles. We're going to have some on this newsletter for you to review about due diligence. Make sure you review those. Make sure you raise your hand and ask questions if you have questions. Give me a call or whatnot. But you got to do your due diligence in order to make sure that you're buying the right practice, because if you're buying a practice and I'm just making this up, of course, but 75% cosmetic dentistry or implants, well, in this environment, you may not necessarily want that practice unless it's also got a huge, strong hygiene program, because as I mentioned, the government's purposefully trying to make sure that we as Americans don't spend as much. So you can imagine that some of the bigger things may not be things that people sign up for immediately. They'll still come in for their checks, they'll still come in for hygiene and whatnot, but again, they may delay the implants, they may delay, the more cosmetic things. But with all that being said, as long as you know that, you're good, right? As long as you know that, you're good. What you don't want is to not know that information, buy a practice, and then get in trouble, okay? All right, if you have any questions, let me know. I'm always here to help. Don't hesitate, but remember, start looking. It's never too early to own your own practice. Talk to you soon.